Hi, so continuing with the medical fact series, I'm up here with a new video in which I would be discussing 3 really clinically relevant points that would help you to enhance your clinical skills as well. The first point is that a mole can be a melanoma in a few conditions. You should be highly suspicious of a mole being converted into a melanoma. In what conditions? The first thing is if it is really significantly different from other moles of the body, which is known as the ugly duckling sign. The second point is that if it starts to bleed or ulcerate, or the third point is if it develops any new nodularity. So in these conditions, a mole can be converted into a melanoma, that you should have a high index of suspicion. So what if it is a melanoma? What should be your first step if you encounter a melanoma? The first step should be the excisional biopsy with 1 to 3 millimeters of the normal tissue margins you should take. So this is really important step, excisional biopsy with 1 to 3 millimeters of the normal tissue margins. The next point is what is Breslow depth. Breslow depth is basically the epidermal granular layer, which is the deepest visible melanoma cells. The next one I want to discuss with you is a really important, clinically important point, that is major depression variant, which is major depression with psychotic features. Basically it is quite obvious that the treatment would be antidepressant plus antipsychotic, but what we need to remember is that ECT can also be used in such cases. For ECT, you need to know really a few handful of points, that ECT is useful when the patient is unable to eat or drink, or ECT is even safe in elderly and pregnant patients also. If the patient is having suicidal ideation or treatment resistant depression, in case of emergency you can go for ECT. Otherwise the medical treatment for treatment resistant depression is imipramine or phenelzine. In the emergency, as I already told you, you can go for ECT. Basically ECT you need to have 3 times a week and 6 to 12 cycles are required. So next comes the glossopharyngeal nerve compression, which happens in the jugular foramen syndrome. Jugular foramen syndrome happens in the posterior fossa tumor. So what would be the manifestations? First is the loss of the posterior 1/3 part of the tongue, has the loss of the taste and the sensation. There would be loss of the gag reflex, and there would be loss of the pharyngeal sensations as well as the carotid sinus reflex, and there would be increased risk of syncope. So this is all about today's video. Please subscribe to my YouTube channel and let me know in your comments. Thank you.